I'm here today with Adam Kahn, physician's assistant to Dr. Martins at Atlantic Health Systems. And today we're going to cover a topic that I think really is so important, but a lot of us don't think about until there's an injury. And that is, what happens, what is the injury and then recovery process when your athlete gets injured? We don't think about it because we're excited about going to the games, watching them play, whatever the sport might be, son or daughter, and we don't think too much about injury. But when it happens, you really want to be prepared for what is the process, what goes on from the moment they go down on the field till the time that they get back on the field later after an injury. So Adam has incredible experience with this. I'm going to tell you a little bit. I'm going to have him tell you a little bit about his background, and then we're going to go right into some things that will be really important for you to know. And I think you'll really walk away from this more prepared for an injury should that ever occur, although we hope not. So Adam, great to have you today here at the Speed School. And so tell us a little bit about yourself, your background, your training, and then how you ended up here.
Sure. So ultimately, I first went to school to become an athletic trainer. I trained at Hofstra University, and then I got hired back there, practiced for about 5 to 6 years while I was taking my post-bac pre-med classes, and then went back to physician's assistant or PA school. And I went to Yale University from 2007 to 2010. And after I graduated there, I had worked with Dr. Martins previously at Hofstra University when the Jets were on campus there. And he was also the medical director for Hofstra University. And so he moved his practice out here in Jersey. When I graduated from Yale, he offered me a position as a sports medicine PA. So really, I've been working with Dr. Martins since 2001, and here at Atlantic Health System and Atlantic Sports Health since 2010.
And really a good time to mention, actually, I should have put it in the opening monologue, but you guys are still the team doctors for the Jets, and so you guys function at a very high level with high performance athletes.
Absolutely. So, Dr. Martins is the head internist for the New York Jets, and Dr. Padovan, one of our other partners, is also, he's the associate. So yes, a lot of connection, obviously, with the professional level athletes.
So here's where I want to go. Parents are at the game, love watching their kids play. Worst imaginable happens, their son, their daughter goes down, and after maybe it's a collision, they don't get back up. What happens? What goes on from right in that moment?
Yep. So unfortunately, a physician is not sidelined, right, at all events. Luckily, here in New Jersey, majority of football games has a physician on site. But really, your first line of defense is your athletic trainer, right? And your athletic trainer will come out and assess the athlete and take a look at them. And really, their determination is, 1, do they need to go to the emergency room? 2, can they return back to play? And 3, is it safe, really, for them to come back to play?
Right. So as the parents are watching, and you can imagine the emotion of watching what happens, they're looking at the person leaning over, probably an athletic trainer. Mm-hmm. They're looking, what are the qualifications of that individual? And it's great because you were one.
Yes,
so
absolutely.
And still are one, I guess.
Yes.
But yes.
So ultimately, an athletic trainer needs to go and graduate with an undergrad degree of 4 years. Majority now actually also have their master's 2 above. And then you have to sit for a certification exam in order to be an athletic trainer certified, hence ATC. And really, the hours that you do in the undergrad setting is what prepares you for when you go out into practice. So I could tell you personally, I did over 2,000 hours during my undergrad training. And then as you come out as a first-year ATC, you do get mentored by the older ATCs before you kind of, let loose on your own. So majority of athletic trainers are very good at the acute management of injuries and, dealing with them.
So we're going to talk more about that, but as a parent, if you were watching and your child was out there knowing what you know, would you be happy that it's an athletic trainer?
Absolutely. And
right.
In the sports medicine world, like I said before, your athletic trainer is your first line of defense. And to tell you the truth, even at the high school level, when your kid starts playing and is participating, you should know the athletic trainer. And if there's a bump or a bruise or even something that's not going to hold your athlete out, right, or your son or daughter out, really to just have that communication with the athletic trainer, let them know who you are and what's going on with your kid so that everybody's involved and everybody's communicating.
So walk us through a little bit. The athlete's down, the athletic trainer makes a decision. The decision on that day in that moment is they need to go to the hospital. what would have caused that? And it could be a variety of things, I realize, but what is the athletic trainer? What's the decision? What are the factors that go into need to go to the hospital versus need to go home and maybe see an orthopedic?
Sure. Well, I think some of it is twofold. One would be, we play sports all hours of the day, right? So if something happens 6 o'clock or later, right, your athlete might just need to go and get an x-ray, right, just to make sure something's not fractured. And now there's urgent care centers, but a lot of times the athletic trainer will say, you know what, let's get this looked at. You can at least have plain films, and then you can follow up with an orthopedic or follow up with a primary care sports physician. The others is, if they're on field, they're getting assessed and something's unstable. They're worried about the health of the athlete. If that's true, then, you're calling 911, EMS is coming, and they're getting directly transported to the emergency room.
Okay. And so, a lot of parents, they've been to the hospital. Different scenario when your emotion's running and it's your own child. What's going to happen in the assessment phase right at the emergency room?
Yep. So ultimately, you got to think of the emergency room as they're saving lives. That's really what their number one goal is, right? So when an athlete comes in, they're going to assess the athlete, they're going to make sure that they're stable and that everything is managed appropriately and they can be discharged or sent home with minimal risk, right? So a lot of orthopedic issues that happen, they're not really managed at the emergency room or the emergency department. What they'll do is they'll stabilize, whether it be a fracture, dislocation, right, or a ligamentous injury of any sorts. They'll stabilize that joint, and then they'll tell you to follow up with an orthopedic surgeon.
Okay. And so let's go to that point. They follow up, and so we'll bring it into Atlantic Health Systems here. So,
Sure.
Because I think this is such a great system. The docs here are unbelievable. The medical staff is unbelievable. And so they're going to come here. What's going to happen? They call over, and good time to put a plug in that we, if you're a Parisi client, we get concierge. Our athletes get concierge treatment. They really do. They get to see accessing docs a lot of time very difficult, especially the level of doctors we have here. But as a Parisi athlete, you get preferential treatment. I'll put it. And so when you do that and you come in, what's the first thing you're going to do in that exam? What are you looking at? What decisions have to be made, with all of that? Talk us through that.
Sure. So, first I just want to mention, who do you go to, right? Who do you call, right? And I think now, unfortunately, with orthopedic surgeons,
Right.
specifically with sports medicine, a lot of things are specialized, right? Your orthopedic specializes in a specific joint, a specific area, a specific surgery.
Right, an elbow, a knee, a shoulder.
Exactly.
Right.
Different docs for each body part. So, here at Atlantic Sports Health, we use primary care sports medicine physicians, right? And those have extra fellowship years of training specific to sports. And they're conservative, meaning non-operative physicians that evaluate your child and take a look. And if it can be managed conservatively, obviously follow that course. If it needs a surgical referral, we know the sports docs or the orthopedics that can take care of the majority of issues and then can get referred out from our office.
Yeah, so that alone is an unbelievable thing. When you think, if you just pick an orthopedic out of the phone book or do whatever, they could have a specialty in one thing, or they could be, an aggressive
Sure.
doctor say, hey, let's do surgery. They may or may not work with athletes regularly. So that's an incredible thing to know. So really, it's almost like triage. It's like they see the doc, and that doc says, here's what has to happen. They're going to have to have surgery, unfortunately. Here's who I'm going to send you to.
Yeah, absolutely. And the other thing to understand is most orthopedic surgeons, they're surgeons, right? So they enjoy surgery and they know that helps their athletes and their patients. Most primary care sports docs, take the more conservative approach. And if you failed that conservative approach, or if surgery is indicated right away, they'll let you know and they'll pass you on, obviously, or refer you to a physician that's qualified and able to, take care of your son or daughter.
Well, that's a measure of comfort right there. As a parent, just knowing you're having somebody overlook and saying they're more conservative. Last thing you want is surgery if it doesn't have to happen.
I agree.
So that's great. So tell us what happens. Let's say it is a surgical situation. They get their surgery. Then kind of what takes place, whether it's a knee or a shoulder, which we see a lot of like in a football thing or soccer or whatever. But what then happens after the surgery?
Yeah. So So this is something we talked about, right? And it's whether it's going to be surgery or conservative management, majority of those get funneled to physical therapy, right?
Okay.
And that's normally your starting block, either physical therapy with a therapist or physical therapy with your athletic trainer at school, either way. But majority of times what we're doing is, this is now a patient that's in pain, right? Can't function, can't do some type of
Right.
activity. We're then first just trying to get them back to normal. And normal means they can do their activities of daily life, and they can function without any pain, and also with full range of motion and decent strength. But in no means are they ready to go back and return back to
Right.
sport. And I think that's why our current relationship with Parisi works out very well. You can call it a step-down program or progression to return to play, either way, but something where they're cleared, no longer in pain, have good range of motion, decent strength, and good with activities of daily life, but now need to get to that next level. So we say, here's where you are, you're injured. We want to get you back here first, which is activities of daily life and your normal routine, and then eventually get you back up here where you're participating in sport at that full high level. And it's nice to have a program where you can kind of put them in, and it helps with that, progression.
Right, and we've had some great stuff. My partner here at Parisi, my co-owner, has that physical therapy background, which is great. So when he interfaces with our physical therapists right here at Atlantic Health, they work together really, really well. So that is a tremendous, program, and it all happens in one place,
Absolutely.
right here.
Yep.
There's very few places that happens like that,
Nope.
and so that's really, to me, that's exciting. So with athletes going back, parents have tons of questions. How do you guys handle the parents? That's got to be, because it's part, that's really emotional more than anything else, and they're looking out for the best interests of their kids. They sometimes, I think, can get aggressive because, so tell us a little about your relationship with the parents and what happens.
Yeah, I think a lot of it for us is protecting our patient, right? And a lot of the times it's letting the parent know on both sides of it, right? Sometimes you have a parent that's a little too conservative and scared to let their, daughter or son go forward. And other times you have the parent that wants to push their kid along. And I think we've seen the quickest somebody can get pushed back, right? When we're dealing with NFL players that are getting paid millions
right.
of dollars, it's a little different, right? That protocol of what we're following is different, right? But here, at the younger level, you're really trying to take a look at the athletes. Are we putting you at risk in any way? What are the risks? What are the rewards? Making sure that they understand what they need to do going forward, and then making an educated decision that we're all happy with, that the parents are happy with, that we're happy with, and that the athlete's happy with.
That is a great point. You've probably seen it more, but I've seen where some parents, and sometimes amazing, but understand the pressures. They have an athlete that may even be at that D1 or D2 level. Sure. Mm-hmm. They get injured at the wrong time in their athletic career, that end of junior year, yep. That where everybody's making the decision. Sometimes a parent will be pushed to say, Doc, can you get him back on the field faster? Yep. Talk about that for a minute. If they do it too fast, do you have the wherewithal, you guys, to say, we're not going to do that?
Sure.
What happens there?
I tell parents all the time, and a lot of times when me and Dr. Martin see patients together, I'll go in and talk with the patients and talk with the parents and let them know what they can and can't do, right? And I'll say, listen, this is the way I feel and what I'm comfortable with. Ultimately, Dr. Martins has to give you the blessing. If you can convince him otherwise, good luck to you, right? Right. I've been working with him for now 18 years. The majority of times we have a very similar philosophy and what it works well for us. But the truth is, a lot of times you sit the parent down and you say, listen, you are putting your daughter or you're putting your son at risk for further injury, and ultimately letting them know that it's going to be a longer recovery if, God forbid, something happens.
Right.
We'll get you back as quick as you possibly can, but not if there's risk of any harm going forward. And
right.
They understand that when you pull back and you put everything in perspective, and you're able to have that talk. But you have to give fine lines, and you also have to be upright and honest with them, right? And really tell them, what's going on and where everything stands. If you waver and there's, not that hard
right.
line, that's when you start getting in trouble. So it needs to be, strict guidelines where we're using, current literature and data and what's specifically supposed to be done, and following what's pretty much been shown as evidence and clinically based medicine.
I think that's a great point that you just made about having that hard line, because parents walk out of a doctor's office and they'll go, well, he didn't actually say, or, they didn't say you couldn't,
Yep.
so I think that's really a critical thing. Tell us, what does, I get the opportunity, and really it's a blessing to me and a privilege, to work with lots of local high school and youth coaches. And we've done a lot together with Atlantic Health, but what is it that you offer? There's going to be coaches looking at this, there's going to be schools looking at this, parents who work at schools. What is it that you guys offer? And I think it's terrific, by the way, but tell us a little bit about what you offer to schools.
Sure. Yeah, so Atlantic Sports Health works with a lot of the local schools in the area. Ultimately, we have that professional relationship, college relationship, and high school. And ultimately, it's really anything that school, either the AD or the coaches, wants, right? It could be as something as simple as being the team physician, which ultimately means we're checking off on some physicals. If an athlete gets hurt or injured, they can call our front desk and they get recognized as if it's a school we're working with. They get rushed to the front a little bit and seen, similar to the concierge service that we provide for a Parisi
Right.
athlete when they call and distinguish that that's where they're coming from.
Right.
The other thing is, depending if you want physicals that are on site, if you want any game coverage, if you want clinic at your actual facility, whether it be your school, all those things are possible. And then the other thing that Atlantic Sports Health has that a lot of other practices don't is a very large outreach program where
Right.
we can provide education material for not only for the kids, but also for the coaches, also for the parents, also for the community, where we have different events that are specifically made for those different type of populations, where they can learn about what's going on and kind of get that education piece built in together. All those things are offered together. It's really just what the school needs,
Right.
and then how
Kinda
we would
craft
fit.
it.
Yeah, each is individually made. It's like you have the full A package,
Yep.
and we can go
Right.
down and down as you go, depending if you want the Mercedes or you want the Toyota.
Right. Yeah.
Anything you want.
No, and this is a great time for me to really plug not just our relationship, because I think we have a great one, but really the reach that you guys have, the abilities, the way things are done, the professionalism that it happens with, but maybe perhaps most of all, the educational pieces. I mean, you guys, every Monday morning, you give educational pieces, and that's not just for staff here or for us as coaches. It's for anybody who wants to attend. You can come to 111 Madison, 7 o'clock every Monday morning, and there's an educational seminar. It could be concussion protocols. It could be, ankle injuries. It could be, whatever. I mean, it's just tons of stuff that is just phenomenal. And that's the word I want to get out to parents, And if parents have questions about today's, discussion, I want to encourage them to email us. We'll get you back in for another section. If there's 3 or 4 questions that keep rising to the top, we'll have you address those, because it's fantastic. So anyway, it's been great. Anything else that you think would be helpful for a parent or a coach to know relating to this topic about, injury, recovery, back to return to sport?
Yeah, so I think, honestly, the truth is, don't be scared to make an appointment to go see, a sports doc if you have questions or concerns in any way. There's never a time
Even
where
without an injury.
Correct. There's
Yeah.
never a time where I'll see an athlete and I'll be like, why are you here today, right? If there's a concern and the parent's concerned or the kid's concerned, there's a lot of stuff that we can do preventative as well. Sometimes,
Great point.
I see athletes that push through stuff, that talk to me that they've been dealing with this for, weeks
Yep.
and really haven't done anything. And unfortunately, those type of situations becomes a small issue that now becomes a bigger issue with overuse implications,
Yep.
right? And that treatment becomes harder, right? It's fine for us for an acute injury and how to manage those, but those overuse things that could have been taken care of in the beginning, a lot easier to address at that time. So don't be scared to, come in and obviously on their own time and during an off season when it makes work, but, to work then not only with PT, but if they're already at those activities of daily life without discomfort or any pain, then that's when maybe they need a speed school, maybe they need
Right.
Parisi, maybe they need that in order to kind of transition them along to make sure that everything, is going well.
I think that is a fantastic point, for you parents to, get to know an orthopedic, get to know, one of the docs that you can come over and get information from, make an appointment with, go sit down. Because if your child is playing, especially, off-season training or multiple sports, it is great to have that relationship before anything should happen, and even to get the preventative stuff that I didn't even think of.
Absolutely.
Which is fantastic. So, Adam, thanks for being with us today.
Pleasure.
This has been
Thanks.
great. And, questions or comments, please, if you're seeing this on social media or on the website, let us know. You can shoot an email or just respond through the social media.